Hi, and welcome to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist. And if you're viewing this video today, you're probably viewing it for two reasons. The first one is you've gone through the shoulder exercise program number 1, and you're having less pain. You can do some of the things that you haven't been able to do, those things that we just take for granted every day. Reaching forward, reaching behind, reaching up behind our backs, fixing our hair, just getting ready every day. You may also find that you're able to sleep more comfortably or even sleep on that shoulder now. So if that's the case, then stay tuned because I'm going to give you all the exercises you need for this shoulder exercise program number 2 to just continue and progress you through this process and start to get some strength in that shoulder. If you are choosing to start here with this exercise program, then most likely you have been having some shoulder pain, but it's probably not on a daily basis and by no means keeps you up or keeps you from sleeping at night. You may find that you have pain with specific motions that you do, whether it's at work or at home, but it's not as frequent throughout the day. And if that's the case, then you too just stay tuned and stick with me. I want you to view all the videos that are included in this exercise program and just commit to performing these exercises for at least 4 weeks to see if we can't decrease your pain and get you back to doing all the things that you need to do. The shoulder is a wonderful joint, but it is very complex. It is one of my favorite joints to treat. I've treated the shoulder joint for 25 years, and so I have confidence in the exercise program that I've designed for you. So if you are having that pain like I described, or you have gone through the shoulder exercise program number 1, and you're ready to progress to the next phase, then I will show you what you need for this particular program. These are some Therabands, and you can get these at your local Target, Walmart, or a sporting goods store, as well as a TheraTube. You can use either. It doesn't matter if you use the bands or the tubes. It's just your personal preference. At Target, they sell these tubes with a handy handle, and that just makes the exercises a little easier to perform, but like I said, you do not have to have that. You can use just a simple Theraband. When you do these exercises, you want to place the Theraband or the TheraTube in the door jamb right at your elbow level. Now, in order to secure that Theraband or that TheraTube, for the Theraband, I want you to put a knot at the end of the Theraband and then just shove that through the door jamb and shut the door. Give it a good tug so that you know when you start pulling on it, it's not going to snap back at you. So let me show you the first exercise in the shoulder program number 2. My Theraband is secured in the door so it doesn't snap back at me. And the first exercise you're going to do is called retraction. I'm going to show you with one arm, but then I'll show you with both arms. So if you have 2 Therabands, I want you to do this exercise with both arms. And there's one or two more that I'll show you that I want you to do with both arms. So it looks like this, keeping your elbow bent and your arm at your side. You're just pulling that arm back so that your hand comes right about to your side or your abdomen. Let me show you this with both arms, and it just looks like that. Right? So that is retraction with the Theraband or TheraTube. Remember, I don't care what you call it, just as long as it looks like what I'm doing. When you do this, as well as all the exercises in this program, I want you to do 3 sets of 12 to 15 repetitions and just once a day. I want you to commit, though, to doing them 5 to 6 times a week. I know that's a lot, especially if you're working, but that's just what the shoulder needs in this phase, in this strengthening phase. When you perform each set, you can rest 10 to 20 seconds between each set. I want you to make sure you choose the resistance that is heavy enough so that it actually does produce some fatigue in the muscle group that you are working, and that you'll feel that fatigue as maybe a burn or an ache. And that's a good sensation. I certainly don't want you to perform these exercises, however, if it causes your typical shoulder pain. So try modifying the exercise. Maybe don't pull back as far or push out as far. Or maybe it's that you have chosen a resistance that's too heavy and you need to try a lighter one. I want to take this opportunity to also tell you that if you have performed this exercise program or any of my other exercise programs for at least 4 weeks and you've performed them as I've described, but you are still having pain in that joint and it's just not changing and you can't get back to doing the things that you want to do, then that's your body telling you you need to go and see your doctor. You may just need more intervention than what an exercise program can do for you. You may need to see a physical therapist. So there you have the first exercise in this exercise program number 2. View the rest of these videos and get started on your way to feeling better.